Wegener's granulomatosis, mysterious disease. Wegener's granulomatosis is a rare autoimmune disease, meaning that a person's immune system attacks its own body tissues, including one's blood vessels. WG can be treated, but if left untreated, 90% of patients will die within 2 years of diagnosis. Cause unknown. Pathogen, inherited, degenerative. Symptoms. Respiratory system, similar to chest cold. Sinusitis, coughing up blood, chest pain, shortness of breath. Symptoms of Wegener's granulomatosis include fatigue, weight loss, fevers, shortness of breath, bloody sputum, joint pains, and sinus inflammation. Nasal ulcerations and even bloody nasal discharge can occur. Other areas of the body that can also become inflamed in patients with Wegener's granulomatosis include the eyes, the nerves, the middle ear, and the skin, resulting in skin nodules or ulcers. These symptoms are due to impeded blood flow. These symptoms can be mistaken for other diseases or illnesses. Cause of problems. Inflammation, joints, mimics arthritis, lungs, mimics pneumonia, kidneys, causes failure of the kidneys, skin, causes rashes, nerves, numbness and shooting pain. The inflammation occurs most anywhere in the body that is possible to become inflamed. For example, the joints, lungs, kidneys, skin, and nerves. Circulatory system. Impedes blood flow to organs. There actually seems to be little restriction on the different body parts that can be infected. Many different organs are affected by Wegener's. In the respiratory system, the nose, trachea, and lungs will be shown in the upcoming slide symptoms. Wegener's also causes inflammation of the trachea, making breathing more difficult. Another aspect of this condition, which can cause problems with breathing, is a direct effect on the lungs. Wegener's causes a condition resembling pneumonia in its effects, and there can be bleeding in the lungs. The excretory system. For some people with WG, the disease is limited to the lungs and doesn't involve the kidneys. Kidney involvement usually doesn't cause symptoms early in the course of the disease and may be detected only by blood and urine tests. However, in time, kidney failure and anemia often occur. The kidneys can actually be shut down if treatment is not taken up early enough. The eyes and orbital cavity. Eye inflammation and/or bulging with or without loss of vision. Inflammation can occur in different parts of the eyes. Inflammation in the white part of the eye is known as sclera or scleritis. Uveitis is inflammation within the eye. Inflammation behind the eye is known as orbital pseudotumor. An orbital pseudotumor, such as those caused by Wegener's granulomatosis, can cause proptosis or protrusion of one eye. Sinonasal manifestations are the most common and include epistaxis, crusting, friable mucosa, acute chronic sinusitis, septal perforation, saddle nose deformity, mucocele, and epiphoria. Airway involvement, mainly as subglottic stenosis, develops in 20% of patients. Clinical presentation includes hoarseness, dyspnea, cough, and stridor. Endoscopic findings include circumferential stenosis and friable mucosa, usually limited to subglottis or extends 3 to 4 centimeters inferiorly. Otologic manifestations include external, middle, and inner ear involvement. Serious otitis media is the most common finding, and facial nerve palsy may be associated with otitis media. Sensorineural hearing loss develops rapidly, in days to weeks. Ocular involvement includes episcleritis, conjunctivitis, retinal vasculitis, uveitis, scleritis, epiphora, and orbital granuloma. Oral cavity and oropharyngeal involvement includes ulcers, mucosal nodules, oroantral fistula, palate osteonecrosis, and the pathognomic strawberry gingival hyperplasia. The first image of an allure that goes around the tongue. This man had strawberry gingivitis, which is one of the many diseases caused by WG. The ear and ear channel. Wegener's granulomatosis diffuses submucosa of the middle ear and mastoid, bilateral, eustachian tube, obstruction, bilateral otitis media, with effusion, subacute, bilateral ventilation tube, leading to hearing loss. Integumentary system. The skin is affected in that the blood flow is restricted. This leads to rashes and the heightened sensitivity of the fingers to cold. The lack of blood flow to this area can even cause infarctions, local tissue death, which can lead to the development of gangrene. Treatment. Treatment for Wegener's granulomatosis is only of the symptoms, since there is no known cause. Treatment is to stop inflammation by suppressing the immune system. Medications used to treat are high-dose cortisone, the immunosuppressive drug cyclophosphamide, trimethoprim, Bactrim can also be helpful to prevent relapse of disease activity in patients with Wegener's granulomatosis. Also, rituximab is a biologic drug that is also approved for treatment of WG. CTs and blood work are ways to diagnose WG. Wegener's granulomatosis statistics. The disease is uncommon, occurring in 0.4 per 100,000 people. Peak incidence is in the 5th decade of life, with an average age at diagnosis of 45 years. However, the disease can occur in all age groups. The male to female ratio is 2 to 1. The disease occurs mostly in Caucasian people. By Molly Riley.